Hi there. I'm going to talk to you a bit about dizziness and collapse in terms of heart problems. The first thing to say is that not all dizziness or collapse necessarily means investigation, but certainly if it's been prolonged in terms of the dizzy episodes, or if you've had quite a significant collapse, then that may need to see a cardiologist. In terms of investigations, an ECG is very useful, again, just to look at the heart to make sure that there's no abnormalities on there that could be leading to dizziness or collapse in terms of heart rhythm. Sometimes an echocardiogram is useful, in particular if there's going to be a structural problem with the heart, particularly in elderly patients, things like aortic stenosis where the aortic valve is narrowed, and that can sometimes lead to a collapse as well. There are sometimes problems with just the vasculature of the body, in particular the blood vessels, dilating and contracting in a particular way, and that can cause the blood pressure to drop, so-called simple vasovasal faints, or sometimes there are more complex syndromes. And that may require something called a tilt table test, which looks at your blood pressure and heart rate response, especially when you're going from lying to standing. Medications can sometimes cause it. So there's a number of different things, and sometimes there are causes which are not cardiovascular, in other words, they're not related to the heart or to the blood vessels. There could be problems with neurological problems such as strokes or other things which can cause problems with collapse. But it's important that you see a cardiologist to get the investigations done, so that then you can then define whether or not it is just something like a simple vagal faint, which just needs some conservative measures in terms of just advising you about how to cope with them if they do happen, or whether they need treatment such as medication, or in some patients it can be a sign of something more complicated that needs the intervention of a cardiologist or a cardiothoracic surgeon. However, it's important that your cardiologist sits down with you and takes a good, complete history to understand how this happens and when it happens, and then they can move forward together with you to define the problem and to treat it successfully.